if there's one industry where we could see the biggest impact of AI is healthcare. So I'm glad we're finally getting to the specifics of that. So, Dr. Ballal, let me kick things off with you. To start by telling us, this game changer for healthcare, AI is often touted as that. How much of that is hype? How much of that is reality in India? And, what are some of the challenges that AI is uniquely positioned to solve for a country like India that you're already seeing play out?
Thank you very much for having me here. And I would like to compliment and congratulate CNBC TV 18 and Moneycontrol for having this very wonderful session. I think the question was, what does AI do for healthcare? I think it can do a lot, but unfortunately, like many things in life, healthcare has been the last to adopt technology and AI. We need to have had a lot more AI and technology in healthcare, but we are slowly getting there. Slow and steady wins the race. Hopefully, at some point, we'll win the race. I think it certainly has changed many things in life as far as healthcare is concerned. One of the biggest changes I see is telemedicine and remote monitoring. We were struggling to talk to patients before the revolution of COVID happened. Believe it or not, there's something good that has happened.
Revolution of COVID.
Yes. Okay. Before, the COVID has had, of course, devastating effects on our citizens. But I think one thing good that came out of COVID has been telemedicine and remote monitoring. And it was sort of quagmired for decades under legal and regulatory affairs. In the last week of 2020, it happened like a miracle. So I think we are slowly getting there. I think remote monitoring, telemedicine, and one of the areas where technology has really helped us is imaging in radiology. I think soon we may not need radiologists, or we may not need radiologists who are not trained in AI. I mean, that's a very blanket statement. I hope there are no radiologists in the group who would throw stones at me.
Well, that's not another example of how AI can take jobs. Like someone on the previous panel said, is the people who know how to use AI can take your jobs. But anyway, with that, Dr. Geetha Manjunath, let me come to you on how you think AI is reshaping the healthcare landscape as we know it, and the key areas where it can make the most immediate impact for healthcare in India.
Yeah, thank you for that question. And it's wonderful to be on this session, also with people I value a lot, and very accomplished sir here. So I'll start with the last line he said, medical imaging. I think he's absolutely right. Among all the different areas where AI is impacting clinically, medical segment is in radiology, because we all know that AI, deep learning, and all of the good stuff really can do very well in imaging and video related activities. And radiology is all about interpreting medical images, which are very, very complex. Every patient is different, etc. Having said that, if I say the same line as a founder and CEO of NIRAMAI, where we use AI for detecting breast cancer, I'll be thrown out of my job. So I will say, just like the previous speaker said, radiologists using AI will replace radiologists not using AI. Coming back to your additional sort of generalized question, I want to classify almost all applications of healthcare into two categories. I would say maybe three, but let's see, two. One, which is more operational efficiency oriented, like improving the patient, the text LLM related activities, also because hospitals also have to communicate with the customers who are the patients, right? The second category falls under the clinical decision support systems. So this area is still to be fully impacted, and definitely the last two. We see very, very few cases where this is going and being used, and typically almost no case where AI has completely replaced a doctor in diagnosing, except in screening, triaging in rural part. So if you actually put an application between the two domains, we know where to have complete confidence in AI, where it will still be doctor plus AI coming together. In the second part, which is very close to my heart, there are several things that AI can do. One is reduce the misdiagnosis or missed diagnosis, both aspect of it, that is overdiagnosis or missing cancers and so on and so forth, which is obviously helpful. It will also actually improve the productivity of the doctors, because it can be that simple assistant who will triage, figure out who among these 1,000 patients need faster access and so on and so forth. So that way, it will help both the rural ecosystem and the, of course, the urban, very, very busy doctors, right? So that way, I feel, AI can actually bridge the healthcare divide that exists in India today.
Well,
and the last bit is really, we talk about healthcare and so on, and again, I don't know how the healthcare specialists will react to this, but we know it's really not healthcare, it is really illness care or disease care right now. So how can we move from disease care to a preventive methodology, illness to wellness? There again, AI can be a great boon by predicting risk to certain diseases with maybe continuous monitoring of some of the health parameters that you can measure with wearables or any other type of continuous monitoring. And also maybe even a weekly monitoring is good enough in some of the cases. So that is another powerful area where AI can be super helpful because it can actually crunch a lot of data coming in from different modalities, different sources, and so on and so forth. And that's the other big area which is going to be revolutionized.
Lots of food for thought there, and we'll get back to some of those issues that you raised. But Laina, let me quickly bring you into the conversation about what you've seen being the biggest impact of AI in the field that you specialize in neurological sciences.
Absolutely. First of all, it's an honor to be here. So we do a thing called brain mapping and advanced brain mapping, and that is only possible because of the use of AI. Like Dr. Geetha said, right, like imaging has become a big thing, but even beyond imaging, video analysis is what we do of the brain to be able to look at connectivity patterns which enable you to understand psychiatric disorders, early diagnosis of dementia, as well as using it for neurosurgical cases to make it more safer. And I think it is these hard cases which till today did not really have much of clinical tools to help doctors. That is where I think AI has such a big role to play. And today a lot of doctors use our products. They have shown confidence in our product and they love it because it helps them get into the surgery room with a lot more confidence. So I think these niche areas are also some of the areas where AI can make a huge impact.
Like Dr. Geetha was saying, there are some areas where AI is completely replacing doctors. Do you see that happening in brain surgeries and in this field that you're in, or is that even desirable?
I would say that we actually add to the creativity of doctors. So a lot of doctors come to us, and when we talk to them, they're so tired of the fact that robotics, AI are touted as ways to replace them. But when we are giving them information about the brain which they did not have access to before, they actually enjoy and get back to that medical challenge which they used to love, the idea of being able to, as a detective, figure out what's going on with their patients. So I think we enhance their creativity,
Dr. Ballal, if you'd like to add to that, and also your experience of using AI at Manipal Hospitals. You've used it across a variety of functions, whether that is nurse rostering, whether that is discharge summaries. How has been the experience using this, and what kind of efficiencies has brought in for the hospital?
Thank you for asking me. I wanted to actually take your permission to answer some of the things that you asked her.
Please feel free, no permissions needed. You have a mic.
I do believe AI, I'm a great proponent of AI, but I do believe that AI with a human touch is needed. I mean, there is a very elegant study recently where they looked at some 50 doctors and they gave them some 7 cases, real cases, to be diagnosed. And they divided them into 3 groups, one which didn't use AI at all, one that used AI, like ChatGPT, and one where only the ChatGPT was fed with the data. And they looked at the differential diagnosis. And what do you think the guesses would be? Who was the most accurate? ChatGPT.
Oh, I was going to say otherwise.
Next came ChatGPT with doctors, and last came doctors like me.
You're not giving very comforting views to some of the doctors or medical practitioners in the room.
But it's interesting. The question is, why did doctors using ChatGPT fare worse than ChatGPT alone? That's because our bias overcame the recommendations of ChatGPT, and we went down the wrong path. And this is a real study on real people, case sheets of real people, real patients. So I think we have to adapt to AI, But I still see a lot of patients who I tell them, you come on a video consult, I'll talk to them. No, they say, I want to see you in person. I want to see you smile. I want to see you examine me. I want you to talk to me about my family. So that cannot be taken away from AI or any other technology that comes. So I think we have to amalgamate technology with the human angle, and that's when the world will go forward.
So that's the scientific aspect of it. What about bringing efficiencies into your everyday functioning as a hospital?
No, I think it would have, it certainly has brought in a lot of efficiency in getting patient appointments, the pharmacy. By the time the patient walks out of my pharmacy, the prescription would have gone to the pharmacy. It's ready. The next appointment, reminders to patients to come back for their tests like MRI or whatever tests we have ordered. Streamlining of discharge summaries, admissions, so on, appointments, so on and so forth. I think what discharges would take about 4 to 8 hours in the good olden days. And I don't think you'll ever check into a hotel where they'll take 8 hours to discharge you or let you out of the hotel. But now it's been streamlined. Within an hour, we send most of the patients unless they have insurance problems. So a lot of efficiency has crept in. And I think with the augmentation of AI, I could do a lot more work as an individual than without that help. Of course, people in my age group surround ourselves with a lot of youngsters who are tech savvy. So what we cannot do, they help us doing it.
Well, I hope some of the audience are listening. We'll come back to you on that. But Dr. Geetha, at NIRAMAI, you're solving for the problem of early cancer detection. Using AI, so far, to what extent has it made these screenings more accessible to people, and not just in the metros that probably are over-serviced, but perhaps to the far-flung areas of India where the infrastructure is not as developed?
Absolutely. Thanks for that question. At NIRAMAI, we have developed a new method of detecting breast cancer. Those of you who are not aware, where we just measure the temperature variations on the chest using a thermal sensor, which looks like these cameras around, and we convert the temperature map to a cancer health report automatically using AI, and about 20 different AI algorithms work on it. So using this, of course, this can be used in hospitals, diagnostic centers as a breast cancer screening device. The best part is we don't even touch the person. There's complete safety because there's no X-ray radiation. It's just measuring temperature of the body, and it's extremely accurate, sensitive, I would say. It's able to pick up stage 0, stage 1 cancer as well.
What are the accuracy levels?
Yeah. We talk about sensitivity, specificity. We have more than 95% sensitivity and false positive rate of less than 10%, which is pretty top-notch, especially when you consider AI-based analysis. And we've compared with mammography, ultrasound, and biopsy as a complementary sort of, reference test, and it's performing super well. Actually, I'm very proud of that. Having said that, in a hospital which cannot afford to have these big diagnostic machines, because we see big hospitals also having these hub and spoke kind of model, right? Smaller centers where people have to come in. This is access in an urban city scenario where you cannot have all the imaging equipment, and definitely, it's an affordable way. You can definitely screen people. Only people who are coming out as red or high scores, then they need to be sent. Now, when we take it to the rural areas, which is what you were mentioning, what we have done is we made this so simple, the reporting so simple, that it automatically gives a red, yellow, green, which even a health worker can understand. Instead of doing hand-based examination, or sometimes just mimicking, do you have a lump, and just bringing the people who seem to think they have a lump, which is very, very dangerous. So we are replacing that completely with a proper, accurately kind of proven method of screening. And we've been able to impact more than 2.5 lakh women so far, done several studies in the rural areas, and proven that we've been able to detect 3 times more cancer than their previous record of screening same number of people. Especially in Punjab, we've done in all the districts. And even in Karnataka, we've done in Gulbarga district a large number of cases, etc. So definitely, I think we've been able to bring in high quality screening services at a very, very affordable manner and rate, being operated by low-skilled workers. I think that's very, very important to get to the scale, right? If you need doctors for even operating the machine, or a highly skilled imaging technician, then it doesn't scale at all. And the most important part we addressed at NIRAMAI is the privacy angle. Nobody wants to remove clothes in front of somebody else just to sort of get a test done. Trust me, unless there is a problem, they don't go to the hospital for that reason. So we have made it completely privacy aware, like a changing room. It's like a booth. The lady enters in it, nobody is inside. The technician is also outside. She, of course, has to remove clothes, but there is only this device in front of it. Remaining things are controlled by the technician. So this no see, no touch, no pain, no radiation technique has made even rural people want to take this test, and it's very fulfilling to see it. Now we are beyond India. Now many of the developing countries have come forward, and it's going well. Thank you.
All right, so that's as far as cancer is concerned. But, brain health, Laina, that's been an underserved segment of, the healthcare industry in India. Give us a sense of what you are doing at BrainSight AI, for instance, to solve for some of the complex diseases, whether you talk about Parkinson's, epilepsy, or worse.
Sure. Absolutely. So let me start with saying that we are one of 2 worldwide companies doing the kind of advanced brain mapping that we do, which is called connectomic mapping for those who are interested. And now this has implications at different stages for disorders like Parkinson's, where it can help in motor rehabilitation. In epilepsy, there are research papers which say about how connectomics can be used to get to the epileptic foci in the brain, which allows surgeons to be able to with more confidence come to the point which needs to be removed. Basically, they use it for their disconnection surgeries. It was also used, in fact, my co-founder's PhD at NIMHANS was on how connectomic analysis could be used for psychiatric disorders, very serious psychiatric disorders like schizophrenia, bipolar, OCD, where you could use connectomics to figure out how to guide rehabilitation. So both neurostimulation, cognitive rehabilitation, these are all, and considering that this is such a huge problem, in fact, the burden of mental disorders to the global burden of disease is one of the highest. And there have never been many technologies which have helped here. And I think connectomics and AI-powered connectomics is one of those areas which can dramatically change how soon you come to a diagnosis and how you can help these patients who for years have never found a solution.
Well, that's wonderful work you're doing. But, quickly, just to put this thing into perspective, the success rate of these complex surgeries, to what extent is that improved with the aid of artificial intelligence?
Absolutely. So I'll talk about the very specific thing that we help in. So after surgery, there is often functional loss in the patient. So different functions like language and sensory, etc., are lost. Now, what we are able to do is use the advanced brain mapping to come to a much more nuanced map of the brain, which allows the doctors to not only look at your traditional networks of the brain, but also cognitive networks. Like the fact that you're paying attention to me is because there is a network in the brain called the attention network. The fact that you're blocking out a lot of information that's out there is because there's a salience network in your brain which is actually doing that. So till today, these kind of networks were actually available only in research and in places like Harvard, Stanford, where you usually had a bunch of neuroscientists working with the doctors. In our case, what we've done is democratized all of that, because with AI, we are able to reduce the functional loss. So we are able to provide this information to the doctor. And as I said, they love the creativity. Now they can actually think about how to reduce attention loss for patient or salience loss, all of those, and they're able to take better decisions. Yeah.
Well, kudos to all of you for doing that kind of work for us. But Dr. Ballal, again, coming back to the kind of efficiency AI is bringing into healthcare, you operate a large chain of hospitals at Manipal. Just give us a sense of how you're implementing AI at scale across your various hospitals across the country, and you're able to deliver the same level of satisfaction and the similar kind of solutions, no matter the geographical location or the size of the hospital.
I think that's a very important question, especially for our chain. Now, in the last 2 or 3 years, we have probably added another close to 30 hospitals to our chain. And these are hospitals in different parts of the country, different levels of sophistication, different culturally. So I think integration has been one of the biggest issues. And in general, we have an entire team dedicated to integrating the various systems. For instance, today, if I see a patient who's come from Calcutta, I can easily access their medical records. But if they came when it was not a part of the Manipal chain, then I would have had to rely on the patient giving me the records so that I don't order the same test or make it very redundant. So integration process is slow and sometimes painful, but that's something we are working on. We have an entire team doing that, and that makes life much simpler. In my opinion, it should not only be integration of a single hospital chain. I think it should be across the country for all hospital chains, because people can come from any care of setup, maybe the government setup, corporate sector, or anyone. So I think the patients need not suffer because we are not integrated.
Well, since we've completely run out of time, Dr. Geetha, just closing comments from you as to what you think is the one breakthrough that you envision in the field of AI that will shape or really change the way we see healthcare in India today.
My favorite one is ATM machine, hopefully in every house, but at least every street, where we can get a preventive view, non-invasive view of what's going wrong with your body. So you just walk in, it'll tell you where something is going wrong, so you can actually go. So focused on preventive, focused on wellness, focused on non-invasiveness of it, I think it's feasible. And we're already trying to work towards that. But there's so many ways of looking into the body without touching the body, without harming the body. I think these kind of, kind of wavelengths, we say, right? These kind of waves can come in and can be analyzed with AI-based analysis so that there is some quantitative information that can be taken out. So that I think is not too far away, and that will be wonderful to have at home if possible.
All right. On that note, Laina, Dr. Ballal, Dr. Geetha, thank you very much for your time here today. It was a pleasure speaking with all of you, and thank you all for being an attentive audience.
Thank you so much.